you, without going into the politics of gender bias, the reality is that we're all different, but there's
Yes.
a very distinct difference between males and females, just using that kind of term rather than genderizing it. And it has to do with very important brain, hormonal, organ, our role,
Mm.
as humans on the planet between male and females is fundamentally different.
Yeah,
So
it's interesting.
and so this
Yeah.
is one of the reasons why I think it's so important to recognize when you're looking at clinical studies and people are talking about clinical trials, you want to ask that very important question. So in the study, do they include both men and women?
Yeah.
One size doesn't fit all.
You know what I find though is that 9 out of 10 times the answer is it was either a man, it was a mouse, or maybe a mixture of men and women. Like one of the most profound studies on fasting, and I've been in the trenches looking at all the fasting
Mm.
studies for years, was one that said that fasting is not a good tool for weight loss. And I was like, this is crazy. I'm seeing people lose weight left and right. How can this be? So I went immediately to the sample size. And when I went to the sample size, in the sample, it was a good size. It was like 1,000+ people, but you had everything from a 17-year-old man all the way up to a 65-year-old woman. And I can tell you, as a 54-year-old woman, please don't compare my metabolism to a 17-year-old man.
Right. Well, I mean, think about it. You're sitting next to a 17-year-old person of a different gender on an airplane, and you're asking somebody sitting in front of you to see what the differences are, and they're obvious, right? So,
Right.
but you're bringing up a really, I think, important point for those of us who communicate information to
Mm-hmm.
people who are interested in terms of
Yeah.
understanding something about their own bodies. And that is that understanding that we're all different and that these differences matter and trying to be as
Mm.
specific as possible when it comes to
Yeah.
gender is actually something that's really, really
Agree.
useful. It's a super helpful thing. So, okay, so to your question, in my work as a scientist and as a physician, and also as an author, I wrote two books, Eat to Beat Disease, Eat to Beat Your Diet. Both of them became New York Times bestsellers. I actually try to hone in on the best possible clinical trials for whatever situation.
Excellent.
If it's about children, let's make sure it's well designed. If it's about elderly, let's make sure it's well designed, right? The two bookends of our lifespan. If it's about anywhere in between, I think we need to take a look at, are they females in the trial? Are they
Mm.
males in the trial? If they're mixed, it's okay to mix them, but then in the interpretation of the results, let's make sure that we're actually
Yes.
analyzing and thinking about that.
Yes.
So
Yeah.
we were talking about powering the trial. That's a term for the people who don't understand, who may not be familiar with clinical trial design. The power of a study. All right. We're not talking about, the Avengers and superpower. We're talking about a little bit of basic math, which is that do you have enough people of the same type in a clinical trial so that whatever the results are fairly reliable from a mathematical and statistical perspective. And so that's the power of a trial. You get a chance to actually design the power of the trial at the beginning of a study. And so one of the things that happens is if you're mixing men and women and then you're interpreting them, let's take a look at the
Mm.
male part, let's look at the female part. Well, you might have actually cut the power in half. So then did you need a bigger study to begin with? And this is something that should be
Mm.
done at the very beginning and not just at the end of a study. But that said, what
Interesting.
I do is I love to look at trials that actually look at women only. And oftentimes, those studies that are about the conditions that women care about the most. All right.
Mm.
And think
Mm.
about breast cancer, which is an area that I work in. I'm a cancer researcher as well as a vascular blood vessel specialist. But if you look at cancer, this is perhaps one of the most feared diseases of all
Mm.
the diseases out there.
Yeah.
Very common in women, very common in women. And breast
Mm.
cancer being the one that immediately jumps to mind. And,
Yep.
all of us know somebody that has been touched
Yeah.
by cancer, but especially breast cancer. And, the good news is that there are increasingly better treatments for breast cancer, and we're beginning to detect it earlier and earlier. But nonetheless, what about when it comes to diet and lifestyle? What is it that's actually good for women in the context
Yeah.
of breast cancer? What's preventative? What can improve treatment? What can prevent cancer from coming back? And this is actually an area that I think is super fascinating that I wanted to share with you and your
Yeah,
audience. And
please.
one thing is that there's a lot of urban legends that are out there when it comes to food and health and food and cancer. back in the day, and you may remember this, is that cancer treatments were either chemo or you had to go over the border in Mexico to go fish
Oh
out
yeah,
some
no, totally.
apricot pits.
Totally. Yes.
Okay.
I live part time in LA, and so that there was a lot of border crossing to get some crazy alternative.
Right. So, but here, if you fast forward to where we are today, what's wonderful is that we are now not looking at food as medicine as alternatives. We are now actually
Mm,
starting to blend them together to see how
I
they
love that.
actually interact. And so I want to give you a couple of examples where there's some urban legends about food
Hmm.
and breast cancer and how it's a kind of like all coming together into a more cohesive story. Look, people are complex, but we're whole people. We're not little body parts,
Mm,
and we're not even cellular parts. Everything kind of works together. And so, what's important is to integrate our knowledge about things, and
mm.
particularly when it comes to women, like not to overgeneralize. So, here's the thing: breast cancer. Like everyone's heard this, that soy and soy foods are
Yes.
harmful for breast cancer. All right. I remember hearing this for years. And I remember when I was in medical school and training, my patients who are women with breast cancer, they'd always sort of ask me like, okay, do you have anything do you recommend to eat for breast cancer? And then they would have a laundry list of things that they wanted to ask me about. It's
Mm,
natural to ask that. So one of the top level kind of fears is that, maybe I should stay away from soy. Soy can cause breast cancer, right? And it has an estrogen, a plant estrogen, right? And so isn't that really bad? Well, so in my work, I'm agnostic to urban legends. In fact, when I find them, I try to smash them. It's kind of like being at a picnic, outdoors with a fly swatter. When you see the fly,
yep.
boom, see if you can knock it out. All right. So
Yeah.
I'll tell you, in my field of angiogenesis, which is studying blood vessels, very early on in my field, it was discovered that tumors cancers are completely harmless. They form in our body all the time until they are able to recruit a private blood supply. A tumor isn't born with a blood supply. A mutated cell doesn't naturally have a blood supply. It'll sit there, it'll grow about the size of a tip of a ballpoint pen or tip of a pencil, and then it can't get any bigger because it doesn't have any oxygen, doesn't have any nutrients. But when cancer cells, like breast cancer cells, are able to hijack our body's own circulation, they begin to selfishly recruit blood vessels to grow into them. And what we
Mm,
found is that if you take a tumor, isolate it from blood supply, it'll stay there forever. Now, in our bodies,
without
without
growing, without
growing,
getting
yeah,
yeah.
and it can only get to 2 to 3 millimeters in diameter. That's the size of the tip of a pencil. That's it. Okay, and then our immune
Mm,
system wings by like cops on a beat in a suburb, and they spot a drug dealer on the sidewalk. All right, they don't even have to be dealing. Oh, they're just sitting there looking like they shouldn't be there. What their immune system does, put that cancer cell in a paddy wagon and drives off with it and gets rid of it. Okay, and that's how our body naturally resists
mm,
cancer. Like many women will ask me, Doc, why did I actually get breast cancer? And, I would try to give an intelligent answer to that, obviously, being empathic to the situation, the state of mind that they're in.
mhm.
But,
Yeah.
when I walk away from somebody who asks that question, I ask myself a different question. I ask myself, why don't we get cancer more often?
Ooh,
It's much
that's it.
deeper, right?
Yeah. What's the answer to that
So,
one?
and the answer is because our immune system wings by, conducts surveillance, and every time it sees a little microscopic cancer, it puts it in the paddy wagon and gets rid of it. All right.
Takes it
And
out.
that's one
Yeah.
thing. The second thing is that our body has this powerful way of trying to prevent tumors from getting their own blood supply, anti angiogenesis, cuts off the blood supply to tumor. No blood vessels, no oxygen, no
Mm,
nutrients, can't grow. Then your immune system comes by and wipes them out. All right. Amazing, right? The other reason is that cancer is triggered by mutations in our DNA. Cancer is just a
mm,
normal cell. The DNA's got a mutation, and now that mutation makes the cancer cell go haywire. It's like having a virus in your operating system or your laptop.
mm,
Weird things
mm.
start happening. That's what happens when it happens on a laptop. You got to, take it to an antivirus program or reboot it. In
Right.
your body, the thing grows into a cancer unless your body's hardwired defense system against DNA damage. It's like a mutation fix. It's like an anti-mutation fix. It's
It's like the Geek Squad.
Geek Squad that you call to actually instead of installing, right? You got my large screen TV's broken. I can't watch the game. this weekend.
That's right.
So you call the Geek Squad, and our body's Geek Squad comes in to fix broken DNA. And it can actually repair it, and it can also put a shield up so that it actually prevents more damage from occurring. Amazing. And then, of course, our gut microbiome. Everyone knows about the gut microbiome now, healthy gut bacteria, 39 trillion of them. It lowers inflammation. Cancer loves to flare up with inflammation. So, when you go to a barbecue in the summertime and you're watching the grill, whenever fat drips into the grill, you get this big flare up, right? And so this is what the flare up is: inflammation. And cancer is sort of like the ribeye cooking on top. And whenever it flares up with inflammation, that cancer loves to grow even more. So the gut microbiome, among many things that it does, lowers inflammation. So if you're a woman and you want to lower your risk of breast cancer or ovarian cancer or cervical cancer or uterine cancer, you want to lower that inflammation. And the best way to do it is already hardwired in your body. It's your gut bacteria. So there's a health defense system. And then connected to that, and we talked about this already, is your immune system, which kind of wings by conducting surveillance. And by the way, if you actually have a big honking cancer that's already growing. So here's a stat about breast cancer that most people don't know. All right. Cancer researchers know it, but most people don't. So we tell women to just be vigilant and make sure, like if you're in a shower, just naturally do a self-exam. So you check for lumps, check for anything that might be abnormal, because the earlier you find it, the earlier something can be done. The earlier that something's done, the more likely you're going to be cured and dodge problems later on. So we feel for lumps in our breast, and the smallest breast lump that you can really feel with your two fingers, that's how you're supposed to feel for them, is about 1 centimeter in size, in diameter. Now, that's a small early breast cancer. So that's why it's so important to feel for that. All right. Now, a lot of people don't realize this, but do you know how, this is not a trick question for you, Mindy, but has anybody ever told you how many cancer cells are in a 1 centimeter tumor?
Yeah, no, please tell me.
Okay. It's 1 billion cancer cells are already in the smallest tumor you can feel in the shower. Okay.